All right, today we're going to talk about something that's, well, it's a hidden and honestly pretty shocking health crisis happening in Bangladesh. There's a new editorial out that's shedding light on a medical condition that's hitting a group of people you just never expect.
So let me ask you something. When you think of a stroke patient, who do you actually picture? Like right now, who comes to mind? Yeah, I'm guessing you probably pictured someone older, maybe in their later years, enjoying retirement. And for a long, long time, that was pretty much the right picture. But that whole story is changing. And honestly, it's changing in a really concerning way.
Okay, to really get a sense of the scale here, look at this number, almost 19%. According to the WHO, that's the percentage of all deaths in Bangladesh related to stroke. It's a massive, massive problem. But that big number, it only tells us part of the story.
Because here's the kicker. The data is showing that more and more the victims, they're young. We're talking about people between 18 and 50 years old. That's a huge shift in who this awful condition is targeting.
So, what does this new face of stroke actually look like? Because we're not just talking about numbers on a page anymore. We're talking about real people, often right at the start of their adult lives. Just take this case from a hospital in Chittagong, a 20-year-old cadet. He came in with paralysis on one side of his body and was severely confused. A 20-year-old. And this isn't some rare one-off story. It's becoming a terrifying trend. So you gotta ask, why? Why is this happening to people who are so young? Well, the answer is, it's complicated. Incredibly complicated, actually. What doctors are finding is this challenging mix of the usual suspects, the common risk factors, and then these really rare, hard-to-diagnose diseases that are just pushing the whole system to its breaking point. So you can basically split the causes into two buckets. On one side, you got the stuff we all know about: high blood pressure, diabetes, smoking, the usual culprits. But on the other side, and this is where it gets really tricky for doctors, you have these rare blood disorders, weird genetic conditions, and things like vasculopathy, which is this dangerous inflammation of your blood vessels. And to get even more specific, we're talking about things like protein S deficiency, which can be triggered by pregnancy or even birth control pills, or Takayasu's arteritis, an inflammatory disease of the body's biggest arteries. Then you have inherited conditions like factor V Leiden that make your blood clot way too easily. I mean, these are not things doctors are normally looking for in a young person, which makes getting a quick diagnosis almost impossible. And then there's this one called moya disease. It's pretty wild. The main arteries going to the brain just slowly start to block up. So the body, trying to fix this, grows this whole new network of tiny, super fragile blood vessels to get around the blockage. The problem is, these new vessels are so weak they can burst or clot really easily, and boom, you have a stroke. It's something you'd almost certainly miss without very specialized brain scans, which, well, that leads us right to the next huge problem. You see, it's not just about these complex diseases. The healthcare system itself is under an unbelievable amount of strain. The actual infrastructure needed to find and treat these young patients is, well, it's stretched to its absolute limit. 60. Just let that number sink in for a second. That's not 60 neurologists in a big city. That is the total number of trained neurologists for the entire country of Bangladesh. 60 specialists for a population of over 170 million people. It's staggering. Okay, now let's talk about the tools they need. 45. That is the total number of MRI machines in the whole country. These are the machines that are absolutely crucial for diagnosing the really complex causes of stroke we were just talking about. And one more number for you, 150. That's how many CT scanners there are. So when you put it all together, 60 neurologists, 45 MRIs, and 150 CT scanners, the picture becomes painfully clear. The resources just aren't there. So what happens when you have these massive shortages? Well, this quote from the editorial just nails it. Patients get trapped in what's called a referral loop. They get bounced from one clinic to another, from a local hospital to a bigger one, just searching for someone who can figure out what's wrong. And all the while, that critical time window to actually treat the stroke is slamming shut. But, this isn't just about pointing out all the problems. The analysis also lays out a really clear blueprint for how to start fighting back. So let's take a look at the actual solutions being proposed. It's a really comprehensive 5-step strategy. First, you have to start with the data. Build a national registry, because you can't fight a problem if you can't measure it, right? Next, you've got to invest in the actual infrastructure and in prevention.
more machines, more screening programs. Then, and this is so important, it focuses on the people, training more doctors and making sure there's financial support, like public health insurance, so that money isn't the reason someone can't get care. It's a huge plan for sure, but it's an absolutely essential one.
Now, you might be sitting there thinking, okay, but this is a crisis happening in one specific country. And you're right, but the lessons we can learn from this have huge implications for healthcare systems everywhere, especially in places with limited resources. Really, what's happening in Bangladesh is a crucial case study. It's a window into what happens when a health system gets slammed with a new, complex medical problem without having the resources to handle it. How they manage to respond, or in some cases can't respond, gives us vital lessons for health security all around the globe. And there are models out there for how to do this right. The editorial points to a study in Norway where they're not just waiting around for people to have strokes. No, they're getting proactive. They're tracking family histories. They're looking for those tiny, early signs of disease, damage that's happening before anyone even feels a symptom. They are literally getting ahead of the problem to stop it before it even starts.
Okay, so let's quickly recap the big takeaways here. First, and this is the big one, stroke is not just a disease for the elderly anymore. Second, figuring out why it's happening in young people is super complicated, thanks to that mix of common and rare causes. Third, the systemic problems, the lack of doctors, the lack of equipment, are just as critical as the disease itself. And finally, the only real way forward is a big, comprehensive plan that tackles all of it at once: the data, the infrastructure, and the prevention.
And that really leaves us with this one big question. When the unexpected starts to become common, when a disease we all thought we understood starts acting in brand new ways, how do we design our health systems to be ready for that? How do we build them to be flexible and strong enough to respond? That's the challenge. And it's not just for Bangladesh, it's for all of us.